stored to the Council website. If any member, officer or member of the public addressing the committee has concerns with this, please speak to our Committee Services Officer straight away. If you're viewing this webcast at home, if you look above the video, you'll see a Resources tab. If you select this, then you'll get a link to the agenda that appears down on the right-hand side. This means you can open the agenda and follow the reports, the discussions and the debate. So do we have any apologies for absence? I have apologies from Councillor Jordan, and Councillor Berry is here as a deputy. Thank you, Bruce.
Chair, Councillor Ivan Camphor is on his way. He was held up in surgery,
right.
But he will be a few minutes late.
Thank you. Does any members have any declarations of interest? Councillor O'Hagan.
I work for the NHS, Chair.
Councillor Cottier.
I'm a director of a construction company that takes part in contracts with the NHS.
Anybody else? Councillor Walsh.
I have a family member who works for the NHS.
I hope to have you've had a chance to have a look at the minutes. Can I have a proposer that those minutes are an accurate record of the last meeting?
Happy to propose, Chair.
Thank you. Councillor Cannon, a seconder. Councillor Gilchrist. Thank you very much.
I wonder, Chair, if I might just ask if the proceedings will take a moment to stand in remembrance of two members of the Council, one the late Councillor Jerry Ellis and most recently the sad passing of Councillor Andy Corkill. We have been doing it at committee meetings that I've been at present recently. Can we do that at this committee, please?
Absolutely. Of course we can. We did it at PNR the other night. I can't join in standing, but I'm very happy the committee do that. Thank you. Thank you, members. And I think all of us deeply regret the loss of both of those councillors and the excellent work that they did during the time that they served. We can move on, but we have no public statements, petitions or questions that have been received. So that takes us then on to the first item on the agenda, which is item 5, and it's a report about the pooled fund, and it's for the Director to take us through the report. Thank you, Graham.
Thank you, Chair. Adult Social Care and Public Health Committee has oversight of all budgetary and service delivery issues for adult social care. With that authority comes oversight of the council investment in and outcomes delivered by jointly commissioned services. In order to have jointly commissioned services, then we enter into pooled fund arrangements with the NHS. The pooled fund as a whole includes a range of services. Some of those are called better care fund services, where a pooled fund needs to be in place in order to access the resource, and some of them are not better care fund services, but are where integrated budgets and service outcomes are an important priority. It also includes some NHS services that are fairly standalone NHS type budgets or services. The total value of the pool fund for 2021 is 235 million, as set out in Appendix 1 of the report. And the report also includes reference to the 2020-21 pooled fund, primarily because the principles of the agreement in 21 to 22 remain largely unchanged. The key significance change is that the budget has grown considerably with additional NHS investment. I suppose the key aim really is to ensure that joint planning and joint delivery of services is at the core of what we do, so that people can experience their services as joined up. And the range of services that we have within the pooled fund often help people back on their feet after a period of illness, for example on hospital discharge. A good example of that is the discharge to assess services that are delivered from the Clatterbridge site by the Community Trust. There are, however, as you'll appreciate, a broad range of community-based locally commissioned services in the pool, and we propose to take forward the £230 million worth of, £235 million worth of services into the new ICS arrangement, which should stand as well for the local direction around decision making and priorities in the borough. Thank you, Chair.
Any questions, comments on that? The Better Care Fund element has already been to the Health and Wellbeing Board. The Health and Wellbeing Board has a statutory responsibility in respect of Better Care Fund, but not all of the pooled fund is Better Care Fund, so we may well have questions. Personally, I'm delighted to see that we've had additional contributions from the CCG. Can you tell us what areas they've come in, Graham?
Yes, if I go to Appendix 1, the primary changes are around the inclusion of primary care, much of which is ring-fenced through into primary care organisations, and another big change has been on the prescribing budget as well. Again, you know, pretty much locked up in the medicines that people need, but an important part of what happens currently from a CCG perspective.
Councillor Gilchrist.
Thank you, Chair. I think most of us, well, we're hopeful at the moment, or would like to think that spending in this year will work out all right, in inverted commas. The worry we have about future years, I was reading a report from the Institute of Fiscal Studies the other day, the sort of thing you do when you're stuck at home, and their projection, they believe that spending in the health services was penciled in at going up at about 3.9% a year. But I was looking back at what they warned of. That was the growth rate they expect through to 23-24. But they then said about, they estimate that new plans allow for little or no long-term additional costs as a result of the pandemic. They estimate that virus-related pressures could amount to 5 billion in 2024-25. Meeting those ongoing pressures would likely require additional funding or less spending elsewhere in the NHS. And that's the little worry that we have. for future years. And I'm not sure how we make representations about that growing path that we see here and make representations about some of the money that's allocated here not being eaten into by other pressures. But I'm hopeful if there are ways that our members have of influencing that situation in the long run to our better, then I'd be grateful if they could be taken. Whether that might mean that the spokes from this committee recognise the current position but highlight the risks for future years and seek to send a general letter hoping that funding could continue on the projected path and that things won't have to be sacrificed. Happily sit down with the other spokes and try and devise something. But of course we're waiting for the spending review on the 27th, and the Chancellor is said to have written it all down by now, or if he hasn't written it all down by now, it's a last minute thought. But I'm anxious about the spending review, but on the projections that we've seen in the past, things look difficult, but might be achievable. But the elephant in the room was that there was a deficit across NHS services in the region in recent years, and under the long-term plan, the trusts and other bodies were supposed to work to try and get that deficit out, worked through, find ways of plugging that gap. So all isn't beautiful on the horizon, I'm afraid. I'll happily hear what the Director says with his connections with the Health Service about what the planning is, but I do have some long-term worries about things are with all the pressures that we face.
Very, very brief headlines, I suppose, from me. So the first, of course, is that we're still in the pandemic, and Julie would probably nudge me with her elbow very hard if I didn't say that. So we don't know what the long-term impacts necessarily are of the pandemic. And at the moment, as I understand it, the excess costs for the NHS across Cheshire and Merseyside is in excess of 300 million, running at that level at the moment. So there is a significant figure there. And of course, in addition to that, we've got some key changes being proposed around social care and the funding of social care. So I think there's a lot in the finances to be worked through in terms of the national plans and how they would apply locally. But a lot of the questions at this moment would be unanswered. Certainly not by me anyway.
I do understand that our local CCG here in Wirral, do they not manage to balance their budget or come close to that ultimately?
I think the issue at the moment is that there's significant additional funding available for COVID. So there is a lot of short-term NHS funding in the system, and that contributes to the 300 million. But yes, the CCG locally has done a reasonable job, but there is that additional demand.
That's a huge amount across the whole region of Cheshire and Merseyside. Any other questions or comments?
Briefly, presumably this was covered by Section 75 last year. Is that Section 75, although covering a great deal more money, is it similar in terms than the previous year, or has it changed?
Yeah, there's hardly any change in terms of the legals of the agreement at all. It's merely the figures, the numbers. Thank you.
No other questions, comments? Jason, no? Right. In that case, I'm happy to propose the recommendations. Do we have a seconder? Councillor O'Hagan, thank you. Right, then we move to item 6, which is Julie.
Thank you,
Your
Chair.
wonderful report. Thank you.
Members will be aware that Director of Public Health has a statutory responsibility to produce an independent annual report every year. This is the 7th report that we've moved across to the Council in reports on actions. So, for example, we did one that very much focused on smoking, and I'll talk a little bit about that as I go through the presentation. The 2020-21 report obviously talks about COVID-19, and it was challenging to come up with a title for this report, but decided to call it Embracing Optimism and Living with COVID-19, because I think we do have some optimism, but I also think we've got to learn to live with COVID-19. And if somebody else can come up with a better phrase than that, I'd be really grateful. So I am going to go through the slides that are in your pack, but I'll go through them quite quickly, because I'm sure that you've all had an opportunity to have a look at them. So within the report, we do a little bit of reflection, and obviously I think we just need to acknowledge that we were one of the first, well, we were the first place, weren't we, in the country when we had to offer help and support to British residents that were repatriated from Wuhan in China. And actually, when I presented this to the Health and Wellbeing Board, I think there was an acknowledgement that the work that we did back in January 2020, bringing together health, social care, community and voluntary faith sector, really put us in a place then where we had good working relationships, and we'd really cemented those through that work that we did over January into February 2020. So we all know, don't we, that COVID has been the biggest health challenge to affect us all for generations. And again, another reflection from me, I never thought, I've said this on a number of occasions, never thought I'd be the Director of Public Health in the middle of a pandemic, particularly when I was only appointed in the October 2019. But that's what we're trained for, isn't it? And that's what you need to be prepared for. So, and I think we've done an amazing job as a borough, our citizens, our residents, and the way that the partners have worked together. So the pandemic has touched us all, but some people have felt the impact of the virus much more and the measures to control it than others. And I think it's also shown us, hasn't it, how valuable our health is and how by staying healthy we protect each other. So it's very much that communal approach. So I reflect in the report that actually I believe that this pandemic has held up a mirror to the existing health, economic and social inequalities that we have within the borough, and that these impacts haven't fell equally across everybody in Wirral. And it's really had an impact on the quality of people's lives. And my other reflection would be that I could have written this report, unfortunately, 2 years ago, 5 years ago, 10 years ago, 20 years ago, and actually would be saying very much similar messages. But what COVID has done really has probably polarised some of the issues. So I think this is a real challenge for us, and I think the Health and Wellbeing Board definitely took that challenge about how do we do things differently, particularly because of the regeneration programme that we've got within this borough, real opportunities to get upstream of the real health issues that people have, so that people do have the opportunity to have the best life that they can do. The next slide really talks about, and you will hear public health, you'll hear me talk about the wider determinants of health. And that's where I believe we've got the biggest opportunity to really make a difference to people's lives. So we know that health inequalities are very often due to factors that are outside of their direct control. Very often it's due to where they live, the type of housing they have, the employment opportunities they have, the educational opportunities they have. We've got an opportunity, I believe, because of the plans we've got for the borough, to really make a difference. And as I say, get upstream of the problems. The next slide, and this report is supported by a technical report that's got all the data and the numbers in it that you would expect, obviously illustrates the statistics that we all, unfortunately all know too well. We know we've got a 10-year life expectancy gap across the borough between the east and the west of the borough, and actually even that will hide other challenges at much smaller geographies. And I suppose this another challenge is really maybe have we come a bit too blind to this data because we're very familiar with it and we can talk about it, but we really need to see action around this. The next slide looks at the borough, because I don't want to talk about the borough in negatives all the time, because there's lots of positives around this borough. The next slide shows you the key statistics related to our life course, from when we're born to when we die, which happens to us all. But you'll see in here that there are some statistics where we're actually better than the England average, and the one I would direct your attention to is smoking prevalence in adults. It's been amazing the way that our residents have really engaged with us to reduce smoking rates across the borough. I never thought I'd see that within the time that I would be working within Wirral, so that's just really great news. But we've obviously got other challenges, and particularly I think through COVID and the lens of COVID, issues around mental health, also issues with regard to alcohol misuse as well. And obviously we need to, as I've said previously, need to really get upstream so that we're really focusing on helping people to get into employment, making sure that they've got the benefits that's needed, really thinking about the quality of the housing that we've got within the borough. So the next slide is probably the question you'll be saying to me, well, what do we do about it? So I think we have made great progress in supporting people to live healthier lives. But as I said, health inequalities are stubbornly persistent. But this is a real opportunity, I think, because of the shared experience we've all had over the last 18 months, and we will continue to have, because as Graham said, we're still in the pandemic, it's not over. And actually, I think the impact of the pandemic is going to take some years before we actually understand the real impact on that locally, well, and nationally and globally, quite frankly. But the pandemic has shown us what we can achieve when we all work together, and actually the speed at which we can make change happen as well when we reflect back what we've done over the past 18 months. So there are 5 recommendations within the report. One is around how we focus on our economic regeneration and ensuring we have a strong local economy. Secondly, about that healthy standard of living for all. A recommendation about support for children, young people and families. A 4th one, which is very much focused around our NHS and a challenge to our NHS to really, again, get upstream of issues. So things like screening programmes, immunisation programmes, how do we work together to make sure that they're really covering all of our population. And a 5th recommendation, which I believe really builds on the work we've been doing with the community, voluntary and faith sector, which is about how our residents and partners continue to work together. So I'm not going to go through the slides, Chair, because I'm sure you want to ask questions rather than hear me talk, but hopefully you will see in slides 9 through to 13, a series of recommendations that I will be taking to each of the appropriate committees to talk to them about how do we actually take this forward, embed it in the work of the committees so that we've got a real work programme and that each committee takes that responsibility around their role in promoting good health and well-being and tackling health inequalities, because this is a cross-council work programme that everybody needs to buy into, I believe. So thank you for allowing me to present tonight, and obviously take any questions from committee members. Thank you, Chair.
Thank you, Julie, very much for that. It's an absolutely excellent report. It's just what we need at this point. I think it is so right for what we need going forward, and it gives us that platform right across all of the council. I can't think of any area of the council and the services that we deliver that doesn't fit into this report. So I know you picked out on some key issues. The smoking is obviously one which is definitely for celebration, that we are in the position we are in respect to smoking, which is wonderful. Highest, the best results in the country. And particularly what struck me reading that report, I was fascinated by the technical report and the figures in it, but and that makes us, when we look at that the difference in life expectation is, where are those years lost? Can we pinpoint where those years are being lost? We know there's 10 years, but where? And we need to find out where those years are coming, where those changes are, and looking at how we can tackle it. Councillor McLaughlin.
Thanks, Chair. And in some ways, I'm going to echo the words that you've just spoken and say thank you very much for this really excellent report, which does take a very rounded look at the issues that COVID brought about, but also those underlying issues which were already there. And one of the things that we learned from COVID is that it impacted on the most deprived communities the most, not only in health factors, but also in income and all that goes along with poverty. And so I thank you for that. The priorities are spot on, and the aspiration to work across not just the council departments, but also health, the business sector, the voluntary sector, especially at the very start, because you had to hit the ground running, and you did a magnificent job, you and your team. But that ability to bring people together in those first days, hours almost, to make sure that those people who were shielding were not abandoned, and all those sort of factors that really built on what is this very strong voluntary community sector in this borough, is an absolute tribute to you and your team, as is the report. And I hope that the aspiration to reduce the gap between life expectancy and life chances as well becomes more than an aspiration. It actually becomes a reality over the years. I know it will take years, but thanks very much for the report.
Councillor Frost.
Thank you, Chair, and thank you, Julie, for the work that your team under your stewardship has done through the last 18 months. As Councillor McLaughlin said, it's a really very useful, very detailed report. I think in terms of how you talked about health inequalities and those that sit with the individual and those that sit with their life circumstance, and I think starting with that diagram really helps us all connect on what we can influence and what we expect the individual to influence for themselves. You mentioned that it needs a joined up approach, and I really appreciated reading your kind of stepped recommendations that go across committee. I guess a question for us, are there any barriers that you see? Because you said everybody needs to first of all align on the problem in front of us, and then everybody needs to play their part. Are there any barriers, or any, whether they're kind of committees or any bodies that you think are not aligned to this? I'm just wondering how we can help make sure that basically we're all singing from this same kind of sheet.
Thank you, Councillor. I think it's about, it's probably not the right word, but I keep using the word challenging, but I think it's keep asking the question about how can we change the rhetoric, which we've heard a lot of, into actually action. So I think the work you do, you're always challenging us about what difference is this going to make. I think those same sort of questions to our partners absolutely is the way that we need to keep asking the questions, because it's how are we going to make this? How are we going to make this difference? I think the challenge will also be that we may well see different services being offered in different parts of the borough. So, you know, that will challenge people, because that will be a different approach. So it's easy to say but hard to do, and I think it's that relentless asking questions, and how is this going to make a difference? How are we making sure that this is using data to deliver our services, to commission our services? How are we making sure that this is based on need rather than wishes, or this is because this is what we've always done? So I think this is challenging to us. And another big thing, you started me now, another big thing is about, I think, around our regeneration. We've got brilliant physical regeneration plans. How are we bringing our community with us and making sure it's local people that have got the opportunity? So I think if you keep doing your job, which is asking those questions, and if you use this as a framework, if you find this useful, I think that would be really, I'd really appreciate that. And that might help with some of the aspiration, the challenge that Councillor McLaughlin gave around the aspiration.
Yes, I always think the most important question to ask is, so what? We're going to deliver this, we're going to deliver that, so what? What difference is it going to make? And that's always the key question, isn't it? We have to ask about everything. So good advice, naturally. We'll keep on asking those questions. Jason?
Thank you, Chair. This is the first time I'm reading one of these reports, as it's the my first year in role. And lots of it makes for really stark reading, and is, you know, these are the people we represent, and some of it is quite to be honest, upsetting. So, you know, it's good to hear the success you've had with smoking prevalence in adults, for example. That sounds like fantastic work. Is there, I've got two questions. One is, are we looking at other councils who have perhaps done similar work to what we've done with smoking? So we might now be kind of like a best in practice, if you like, best practice for other councils to look at to see the work we've done. Are we looking at other councils to see what work they've done, say, on things like life expectancy and depression and things like that to learn from them? And then the other question I had is just a very simple one, is which committees are you taking this to as well? Thank you.
So I'm hoping to do a roadshow to all the other committees. That's the plan. And with regard to best practice, yes, then look, obviously, public health, it's all about the evidence base. That's been one of the challenges through the COVID pandemic, quite frankly, because the evidence base wasn't there and it's shifted. So it's always about what's the evidence, and then we use that, yes, to then put forward our recommendations. And if we haven't got an evidence base, then, you know, we will go out and we will talk to local people if that's appropriate, or we'll look at the data and do that ourselves. So using data and analysis to drive this is fundamental. And that's the way we're also going to be able to look at change over time as well. So that's another thing we need to do behind this, is an outcomes framework as well. Thank you.
Councillor Gilchrist, and then I'll come back to you, Councillor Frost.
Thanks very much. Thank you, Chair. You know, if I had a nice big stick of rock that was big enough, I'd have all these themes, 5 themes, going through it, so that every time I took a bite, I could see what I was supposed to be doing as a councillor for the community, or what the council was supposed to be doing. So I think at the Health and Wellbeing Board, I suggested that we had a screensaver or the like that hit council staff every time they turn their computers on, reminding them of our aims and purposes. And forgive me if I look at perhaps at page 33 of your report in section 2. And there are a number of bullet points there, but the one that is more and more relevant in the fuel price hike that we're facing at the moment is the bullet point that says, we define and streamline fuel poverty support pathways with partners across Wirral, learning from the COVID-19 response. And during the COVID-19 response, I think party leaders, we met pretty well every week and heard about the work being done at Bidston and through the various support centres, bringing organisations together. We also had occasionally a chart which showed how many households have been helped with some of the basics, like sorting their heating out or some of their other essential household items now. I noticed recently that the government introduced or announced the new household support fund of £500 million. Now, it's distributed around the country on a particular formula. My reading is that Wirral will have just over £3 million. So what I'm hoping is that there is discussion amongst the senior leadership team. There will be discussion amongst leaders about how we're going to operate at that, learning the lessons from COVID-19 and how we help people who are sitting at home worried about turning their fires on, worried about their heating breaking down, wondering about some of their white goods failing, but how we reach people throughout the borough who have reach crisis point during the next few months or 6 months, whatever it might be. So if that suggestion is taken away, so we know what is in place, what can be in place, and how we can leap into action to do what we did during the pandemic, I'd be grateful if you kindly take that away to your senior colleagues. Thank you.
Absolutely, and actually we've got a meeting next week because Mark Camborne is very much taking a lead on that, Councillor Gilchrist, so we'll pull something together, and I'm sure we can then share that through the group leaders meeting. Yeah.
Councillor Frost.
Thank you, Chair. Sorry, Julia. My other point I'd forgotten, and I wonder whether, given your point around living with COVID, whether future versions of your report will always be COVID-centric and kind of total health, or whether that at some point in the future they will go back to a specific focus like your smoking piece. And kind of reading through this pack and then data further in our collective pack around Wirral doing worse than national average on every alcohol misuse indicator and the repercussions. And I know it's one that this group has talked an awful lot about in terms of the link to domestic alcohol misuse and domestic violence and abuse. And I wonder whether the work that you did in your team around smoking and the pack on smoking and the positive indicators and the repercussions, whether there's room to either focus or part focus, if it always has to be a total COVID and then there are bigger segments. But I think galvanising all of your collective committees around, reducing rural alcohol misuse rates or getting them at least in line with national averages feels like there could be immediate for the individual health and then broader for the community health. It could be positive benefits.
Thank you, Councillor Frost. So I think future reports always open to suggestions about what they should be, whether they should be thematic or... we've obviously got the Joint Strategic Needs Assessment, so that will provide an annual review really of the data and very much a technical response. And then if we need to deep dive into particular subjects, then we can do that as well. And obviously always open to have comments and suggestions about future topics. But I like your idea about the alcohol one. Thank you.
Councillor Mountney.
Chair, thank you. Thank you for the report. I found it really interesting. Looking at your 5 priorities, number 1 is prioritise the economic regeneration, strong local economy. And I'm wondering how your role and how you might make that happen, because that's clearly not primarily your job, but prioritise is a big word. And how are we going to do that is my first point. And the second one is I think I recall sitting in this meeting about 10 years ago when this smoking issue was raised previously, and we've clearly done unbelievably well. There must be lessons in there that we can take. I don't know where we stand with encouraging people to visit the doctors and things, and there must be lessons we can learn that we can roll out across here. And how are we doing that, please?
So I think my role in this is actually to be a bit of a nuisance and keep asking the questions. We've done, so there's various tools we can use. So we've worked with the Regen team and we undertook a health impact assessment of the local plan. And that's where we looked through it and saw where were the positives and where were the negatives and how could we mitigate against any negative actions. So I think that's our role, is continue to use the tools and techniques that we know to connect our Regen team into the community, voluntary and faith sector that we've got really strong links about, so that we make sure that that community voice is there all the time. But I think my main role is to continue to ask the questions and to make sure that those recommendations are at the forefront as we're discussing the various plans that are going forward. So we're currently talking to them about, at the moment, about how to do a health impact assessment of Dock Branch Park, making sure that, again, that when we review it through our eyes, where do we see any negatives that we can mitigate against that we think might cause some health issues. With regard to smoking, I mean, that's just been an amazing coming together, really, of policy issues, but then also a commission service that was much more flexible than the previous commission service. So I think it's been a real, and then local people being in a place where they actually wanted to make a difference to their health and well-being. So it was bringing together those various elements, and sometimes there's a bit of serendipity in all of that. But I think the way that we approach these things is, as I said before, about using the data, linking it in with good commissioning, but listening to the voice of local people about what do they want. And we had some treatments as well that we didn't have previously for people who wanted help in stopping smoking. And we've had some great peer people, people who've been talked about their story of giving up smoking. I think, did that answer your question?
It does, thank you. I just encourage us to try and find the next one, make it happen again.
You can do that after lunch, Julie. It's okay. Just create the next miracle after lunch. Yep, Councillor Walsh.
Thank you, Chair. I just wanted to pick up on the regeneration piece because I think when I turn my head, you can't hear me. Sorry. I mean, it's really exciting what's going on around Wirral Waters, Dock Branch Park, all the things going on in Birkenhead. And the one thing that is in the back of my mind and concerns me is the fact that you could push people out of Birkenhead who are from Birkenhead, because the first homes that we've seen on Wirral Waters are averaging over £300,000. It's not affordable, and the definition of affordable housing is lower than the market average, which if it's £200,000, if it's less than that, it's affordable. Well, not if you're on minimum wage. It should be down to people on the lowest incomes. Can they afford them? So I guess my question, probably following on from Councillor Mountney's, is how can you help kind of make sure the deprivation doesn't shift because of the regeneration, if that makes sense? Does it make sense?
It absolutely makes sense, and that's the question that I and my team will carry on asking. Yeah.
Yes, thanks, Julie. Not just you and your team. Alan Evans is sick of me saying yes, but I'm really pleased that these new properties are going for whatever they are, 300 and something thousand, but that's actually no use to people who live in Birkenhead at the moment. So yeah, it's all of us, I think, on this committee who need to be asking those questions everywhere we can. Any other comments? Councillor Camphor.
Thank you, Chair. Sorry about my late arrival. My apologies. I've got a couple of questions really about the 5 recommendations which are made in this document, which are very good, I have to say. However, I would like some clarity and clarification around a couple of them, namely number 2, where it talks about safeguarding a healthy standard of living for all. What I would like to know from you is, what is the benchmark that you're using for this? Or is there a benchmark that we are using? Is that across Wirral, or is that across England? Is that across the UK, or is it that across Europe or the rest of the world? And if so, how are you going to measure that, and how are you going to implement changes from that? So that's my first question. My second question is increasing support for children and young people and families. That's great words. But we all know that in COVID times, mental health services for children have suffered significantly. And given the current circumstances, what is the local council going to do to ensure that children and young adults get a fair share of the services they should be offered, not just in the Wirral, but across Wirral? Thank you.
I think that the recommendations for children and young people are quite specific in here, Councillor Camphor. I can't answer that question with regard to mental health services. I don't commission mental health services. But obviously, we have our Joint Strategic Needs Assessment, which talks about the needs around mental health services within the borough, and we will continue to work closely with both the CCG and our children's colleagues, obviously, to make sure we take that forward. And I heard some great work today about some local a local service that's been very much linking CAMS with Tier 4 services, but I am not the expert in that field. With regard to the benchmark, with regard to standard of living for all, I did mention, I think it's before you entered the meeting, that we will be coming up with a set of outcomes that go behind this report, and obviously that will be part of that. Thank you.
Thank you, Julie. Yes, I'm sure that, again, as this is going round the various committees, I'm sure that Children's Committee will be wanting to participate and to comment very much on how they see they're going to make their contribution towards achieving some of these objectives. Anything else? Any other comments? Questions? No. In that case, thank you Julie, and I am more than happy to move the recommendation that we endorse the recommendations within the Public Health Annual Report. Do I have a seconder? Councillor Frost, thank you. Thank you very much for that, Julie. That brings us to item 7, out of hospital review, which is for Graham. We've called it something different, haven't we now?
Thank you, Chair. Yes, the paper is headed the out of hospital review, but in essence what I'm presenting here today is the Living Well in Our Community programme of work. That represents an important shift in the thinking of Healthy Wirral, which includes local authority, but is primarily led alongside our health partners. And that shift really is from a challenge which was about thinking about whether we've got the right range of services around the hospital and, you know, enabling people to get out of hospital or be supported effectively, to recognising that's an important part of the picture, but actually what our range of community services should be doing is focusing on outcomes for population health delivered through a more localised neighbourhood approach in terms of service delivery. And I guess the key question really is, do the range of services that we commission and deliver answer the questions that have been raised in the Director of Public Health's report? And are they going to help in terms of reducing those inequalities and tackling some of the key determinants of health there? So in a nutshell, that's the kind of background to the piece of work. In order to reflect that, then the programme of work has 4 key pillars: healthy behaviours, community in place, integrated health and care, and service commissioning. And each of those are priority areas that reflected in the programme, with just a small number of elements in the first year or 2 to be tackled, but clearly that will evolve over time. So really what we wanted was a structure that shows how we can review those services that are commissioned out there by health and care in order to have them much more aligned to, if you like, our health and wellbeing strategy and the key priorities set out by the Director of Public Health. Thank you.
Questions? Councillor Camphor.
Thank you very much, Chair. I'm minded by this report 3.4, which says approximately 12% of the people in Wirral are over 66, but they represent 40% of hospital admissions. That is actually very much true. And the problem we have across Wirral, but perhaps across the whole of the United Kingdom, is not just hospital admissions, but discharge outside, and having the infrastructure in the community to sustain that discharge. I see little evidence in this document that suggests that there is a robust programme which is supported by qualified and trained carers and other clinicians and care workers in the community that can support accelerated discharge from hospitals, given that we're entering the winter period where it's predicted that the hospital admissions are going to increase. So my question to you really is this: what can you tell me to reassure me that there is a robust programme and an infrastructure that will support the current or the forecast winter crisis that's upon us soon? Thank you.
Thank you, Councillor Camphor. You will note this is a strategic programme reviewing a whole range of services. It's not our winter plan. We have published a winter plan which has gone to NHS England, which does exactly what you talk about. So it might be sensible to get hold of a copy of that. I'm sure you'd find it very reassuring. Page 127 of this report does set out the structure, however, of the review, and you'll notice within there there are 2 columns that relate particularly to the problem that you've set out. The column under integrated health and care sets out a number of areas of work that link to a range of activity that are either enabling people to be supported more effectively from hospital, or are about people being supported not to go into hospital in the first place. And if we think of the frailty programme, for example, there's a number of elements of that around falls prevention and a whole range of other things in there. And of course, in the final column, commissioning, Better Care Fund, we have had presentations here previously around the Better Care Fund, and I think you missed the paper earlier on the pooled fund, but there are a number of factors within the pooled fund around how we commission a number of services to enable people to be supported from hospital discharge. So I think in summary, just to say that this is a longer term programme, and it is very much more about shifting away from our pure focus being on hospital discharge to much more around, if we're going to invest, we want to invest in population health in the longer term. And I think that is very different to the question, which was about what are we doing over this winter, which is a very short term position. Thank you.
Councillor Gilchrist, then I'll come back to you, Councillor Campbell.
I think it's not that long ago, Chair, that we had a report on the discharge to assess beds and the changes that might involve Clatterbridge and the number of care homes and changes from care homes to Clatterbridge. But I won't go into that now. My query is to find out who is on the board in this report that is discussed. Perhaps we could have the membership circulated when convenient. Sad to say, we have a whole series of organisations which it's easy for members to lose sight of who's doing what and who's in charge of them and who chairs them. So I'd be most grateful for a list of the people on the relevant boards when it's compiled and set up. Thank you.
I will, of course, and I think that is an omission in the report, and we'll see to that right away.
Thank you, Chair. So just following on from my question, thank you very much for pointing me to the diagram that you have on page 127. However, it's not very clear in this diagram of other sort of or specific sort of diagnoses and management of care. For example, dementia, for example, heart failure, for example, patients with chronic diseases that are perhaps not falling into the nursing home category. It's about those patients that make the 44% or whatever 40% of the 66 years and above that come back into care into their own homes, which is really, really important. So whilst this is a great diagram to follow and gives us a great idea of what care can be, perhaps in a residential or a nursing home environment, it doesn't give me any reassurance around patients being discharged to their homes and having the support and the network to provide them with the care that they would have ordinarily been provided with in the hospitals. Thank you.
Thank you, Councillor Campbell. And I guess that the question really is, where is the full picture of our whole health improvement programme for the borough? And I do think that there's a link there to the Healthy Wirral programme as a whole. Now, if committee would see that as something that should come to this committee, then that's absolutely fine. It probably sits most appropriately under the Health and Wellbeing Board as the committee that oversees the whole partnership in the borough, but it could also come here. And I think that certainly those sort of clinical pathways that Councillor Camphor is referring to are very most definitely within that overarching structure. This is quite focused on the services that we commission as opposed to clinical pathways, and I can see how that would present a picture that doesn't present the whole picture, it only presents part of the picture.
Yes, so perhaps if we bring the programme, the actual Healthy Wirral programme, and that could go along then with the board, which would give Councillor Gilchrist's answer Councillor Gilchrist's question. But we are on it, Phil. That's the important thing. We are on that Healthy Wirral board, and at the moment I'm jointly chairing it with Michael Brown from the community trust. So we've got a say in there. Any other questions? Councillor Walsh?
Thank you, Chair. It's a really small, simple question. On the diagram, there's dark blues and greens. I don't understand why the greens are green. Can you explain what the reason is?
I have no idea whatsoever what those colours represent. I just assumed they were presentational.
Thank you.
Any other comments other than on the director's presentational skills and his PowerPoint ability? No? Right. In which case then that brings us to the recommendations that we support the renaming of the Out of Hospital programme to the Living Well in Our Community board to better reflect the aspirations and ambitions of the programme, and then we go through the other recommendations. Do we have a proposer?
Yeah, happy to propose, Chair.
Thank you. Do I have a seconder? Councillor McLaughlin, thank you very much. We're taking that by assent, I assume. I haven't seen anyone voting against it. Thank you. Oh, right. So it's Graham again on the budget monitoring this time.
Thank you, Chair. So this is the budget monitoring report for month 4, with a predicted forecast position of favourable £619,000. That represents 1% of the budget. But it does show that the stewardship of this committee and the focus on budget performance has been strong, and the budget is where we would want it to be. Forecast savings, the achievement of those savings has been relatively good. However, there is some more work to do with Cheshire and Wirral Partnership Trust that are responsible for the review and support of people with the most complex disabilities. And I know that Jason's doing some more work with the organisation there to see if they can step up and deliver more effectively in terms of their responsibilities. But of course, this report is in the context of an ongoing pandemic. And of course, the sort of winter pressures that Councillor Camphor was referring to as well. So there will be ongoing pressures, and there's certainly pressures around the hospital at the moment for discharge. The NHS is supporting with those discharges, so we have had an extension of the grant that enables people to come out of hospital with financial support for a period of time, which does protect the social care costs to a degree. And that, is very helpful at this point in time when the system is under pressure. The reason I mention all of those things is because clearly 1% of the budget, it doesn't take a huge shift to take things out of kilter or a big change in terms of the way that services are funded. The report does also offer graphical data in relation to activity, and that covers key service areas in order that members can see levels of demand against the levels of cost. Thank you, Chair.
Any questions for the Director on the report? No? Oh. Councillor Gilchrist.
I'll just ask about one particular area which is touched on, and that is on my numbered page 133. In table 3, it refers to the change initiatives and the work being undertaken by Partners for Change. I seem to recollect it being raised at committee by other members who were interested in exactly where they had got up to and how they were beginning to change the way staff approach issues. And I wondered if the Director could give us an update, or Jason could give us a comment on how things are going, if we may.
Thanks, Councillor Gilchrist. The programme has been operating on 2 innovation sites with a selected number of social work staff, and they have been working differently with people and developing new processes for addressing when people request care and support. The programme of work is reaching a review point where we expect to get some evaluation data so that we can review the effectiveness, what's been achieved, and then make decisions about rolling the programme out further. So at that point, I would be very happy to share some data, some numbers of people that have been supported differently, the types of outcomes that have been achieved that might be different from more traditional approaches, and any benefits and comments from people that have been through that different process. At this moment in time, it's just coming up to that evaluation point, so it's probably best if we just wait to collate some of that data, and then I'll be happy to share it.
Yeah, I understand from a conversation I had today, we're in week 11, and the evaluation is planned in for week 13, so we're close to that. Is that right, Jason? That was what I was...
That sounds about
today.
right.
Yeah. Thank you. Any other questions on the budget? No. Keep reminding me it's only 1%, but still means we can look smug in PNR. So, right, that takes us item 9, performance monitoring. That's definitely down to you, Jason. That one. Yeah. So we need to move the recommendations that you note the end of year review forecast and note the progress.
Are we on to the performance indicators?
I just need a mover for the
previous one, the budget one.
Yeah. Just
Okay,
move the
well, I'll
budget.
second that one.
We'll do that then. Yeah. Okay. I'll move that.
I'm very keen to get onto the performance.
Councillor Bolton will second it, and then she can ask a question on the performance monitoring.
It is, yes, it is, and does relate to the previous report, which, and I'm sure we're all very pleased to see that the budget position is favourable this time of year, and that's great. But when we had the leaders' meeting, sorry, I've inflated my position, the spokespersons meeting the other day, I asked, was a favourable budget position any reflection of the amount of activity being undertaken in the department, and the director gave me a reason for why there was a problem with activity, but it wasn't related to the budget. However, I just would like to draw members' attention to page 32 and page 34, which does show a very significant drop in the number of clients on the receipt of domiciliary care packages over, not just from Q1, but from previous, over from 2019. And then on page 34, a commensurate drop in the cost of those care packages. So how much of that is influencing our favourable budget position at this time? And I think it might be helpful if the director was able to explain to the rest of the committee the explanation he gave to me the other day about what was going on in the care market at the moment, or perhaps you would do that, Jason. That's one issue, if you wouldn't mind dealing with that. It's quite convoluted. Hope you've got the essence of what I was saying. And the other aspect that I'm a little bit more concerned about really is that we haven't seen very much about performance in the health side of things for quite a long time. We haven't seen data around hospital admissions. We haven't seen data about A&E waiting times. We haven't seen data about ambulance waits, although we're hearing anecdotally that the situation is very serious now. And also, I won't be the only member, I am sure, to have been approached by people who are concerned at the difficulties they're getting face-to-face appointments with GPs. And I mean, I did hear of a case the end of last week, a lady spoke to me about being offered for a 6-year-old child who was complaining of on and off abdominal pain, and being offered an appointment at the GP, a face-to-face appointment at the GP, on the 3rd of November. And that, to be quite honest, shocked the life out of me, for a 6-year-old child who's complaining of pain in their stomach from time to time, to be asked to wait 3 weeks before somebody can touch their tummy and feel out what's going on there. So I think it would be a good idea if we could have some of those performance indicators brought to us again, because it's part of our role, and we haven't had that. I understand the health people have been under a lot of pressure, but nevertheless, it's part of our role is to monitor what's going on in health, as well as what's going on with our own provision of service. So I'm sorry about the long-winded contribution, but there we go.
Right, thank you for that. Just out of interest, we have been advised that the total number of general practice appointments in September of 2021 was 160,387 appointments, and 55.1% of those were face-to-face. That was a 12.7% increase apparently on September 2019, so we have a huge amount. And I think what I'm hearing is very similar about A&E, just the sheer numbers. We got some reports the other day, didn't we, Graham? Just the sheer numbers are, and I know the steps are being taken, which I'm sure the Director will explain.
So, Chair, would you like me to introduce the performance report and then take the question? Would you? Is that okay? Okay, thank you. I'll just briefly highlight a few areas in it. So this is the performance reports dated September. Members are recommended to note the content and highlight any areas requiring further clarification and action. Generally, I would say there's very little change overall in terms of performance as compared to the report that came to the last committee. And I'll just highlight a couple of areas. So care home vacancies remain, care home numbers remain relatively stable at 1,513, and that's on page 156 of the electronic pack. So we are seeing that relatively stable despite the demographic changes and the pressures in the system in terms of volume of hospital discharges and so on. Care home vacancies do remain at a similar level, slightly reduced at 18.8%, and that's on page 161 of the electronic pack. The vacancies reported are reported through the NHS National Bed Capacity Tracker. What we know, though, is that 18% or 19% vacancy rate is actually the potential beds that would be available. Not all of those care home beds are available for immediate admissions. We've been in touch with NHSE, the regional lead for the capacity tracker, and they have agreed to amend the capacity tracker to show not only the total possible care home beds in the system, but also an extra column of information around available beds, which can be accessed from people in the community or on hospital discharge. So that will be coming on stream very quickly. Care home quality does remain an issue. We've discussed that at this committee previously in some depth. We have around 66% of our care homes in Wirral that are rated good, and 32% of the care homes requires improvement or inadequate. So that's a much higher percentage of the care home market that we would expect to see, and our quality improvement team are continuing to work hard to improve the standards with those care homes, and specifically for them to address the areas in their action plans of underperformance to satisfy the CQC inspectors that they've made the required improvements. So we are continuing to focus work on that. The T2A transfer to assess occupancy and average length of stay in the report at page 173, I would suggest may not feature in the next report or the one after because of the new single site discharge to assess service at Clatterbridge run by the Community Care and Health Trust, which is in the latter stages of implementation, with 2 wards of the 3 planned wards being currently open and being used as business as usual. Early indications are that that service is doing what we hoped and expected it would, and it's averaging a length of stay around 3 weeks and supporting people home, as opposed to the average of about 5.8 weeks in the independent care home sector that we'd seen previously. So we should see some data presented slightly differently in future reports to reflect some of that. And then finally, the social work team's performance is on page 204 and thereabouts, and performance remains generally good. We've provided some information to chair and party spokes as to how the performance is monitored and how improvements that are required are being addressed and monitored. We are seeing capacity in the system to do reviews affected by the numbers of new requests for services and the numbers of discharges coming through hospital, which of course do take priority over reviews. So the numbers of annual reviews and planned reviews isn't where we expect it to be, and we've been in discussion with the trusts about how they resource that capacity to undertake more of those reviews. So I'm happy to take any questions, and I'll start with Councillor McLaughlin's questions. So in terms of the domiciliary care drop, I think you're referring to around page 32. So I would suggest that that's incomplete data. We've seen domiciliary care more or less continuing at a high level. So the last report for Q2 shows a significant drop. Now, I don't recognise that as an accurate picture because we are seeing high levels of domiciliary care continuing. But what we are seeing is that capacity in the sector is affected. We did discuss that at our budget monitoring meeting, and that's largely due to staffing within the domiciliary care sector. We do have recruitment and retention issues. Up until recently, I think we've been relatively well not insulated, but we've been relatively unaffected by some of the more significant pressures that other areas of the local authorities and other parts of the country have seen in this sector. Wirral tends to have a relatively fixed pool of staff resource living locally within the peninsula. There's not a lot of movement of staff across from other areas, and we're not reliant on, for example, European nationals to support the sector. So we've seen less volatility in the sector generally up until recently. What we are seeing now is a sustained position where the national issue around recruitment and retention into the sector is being evidenced in Wirral, and our care providers are struggling to attract care staff in and to retain them. It's largely due to competing with the retail sector and the hospitality sector as that area of the economy has opened up after lockdown restrictions being lifted. There are recruitment issues across those sectors too, affected by various aspects. So what we are seeing is we are seeing that playing out in Wirral now. Quite a few staff have left to work in the NHS, which is great for career development opportunities and is a real positive to attract new people into the care sector because it demonstrates that it's a good career choice and that there are progression opportunities within the sector. So we're doing a lot of work to address that, but that is a pressure at the moment, and we are seeing some difficulties in rates of discharge due to pick-up rates from the domiciliary care sector. But I do think that column on page 34 and 32, I think that's incomplete data for the period. Okay. On the health data, I do agree. Previously, we've had a lot more data available for scrutiny and consideration. We do collect that data, and we look at that data regularly on a 2 to 3 times a week basis with our partners. We have system leadership meetings and discussions daily, and we do look at that data on a regular basis. We looked at it earlier today, for example. So I'm quite sure that we can put a regular pack of information together for members, and perhaps we might ask members what exactly they would like to see within that. Certainly, the ambulance turnaround data is available. The GP appointments take-up and percentage of face-to-face appointments as opposed to virtual appointments is available. And the A&E waiting times and whether or not the hospital's met its targets for 4 hours through A&E, that's all reported regularly, so we can pull that together, I'm quite sure.
Thank you, Jason. Any other questions? I suppose as well, some of that data would now probably go to partnerships, because they now have the... Yeah, but partnerships also have the job of scrutinising our health partners, don't they? That we contract with. So I don't know. Maybe some of it. Councillor Camphor?
Thank you, Chair. So whilst the topic of general practice appointments is very topical and relevant, and I accept that, I think what's perhaps lost in this narrative is the lack of mental health services across Wirral and the difficulty in accessing that. And I have mentioned that on several occasions previously, which I think is a real tragedy that's happening in the Wirral, along with the mental health services for children. Perhaps we could use that in the indicators that you sort of review regularly and report back on. Thank you.
So this report is largely to do with the adult social care activity and performance, and I suspect that some of the information that you're referring to may be to do with mental health bed-based services and community teams response times and perhaps specialist placements.
No, just access to a consultant psychiatrist.
Okay, so that's possibly data that can be collected via the NHS and reported through either the Partnerships Committee or to here, but it's not information that we would probably include in the social care performance report.
Thank you, Jason. I'm also assuming that information in respect of children's mental health services will go to the Children's Committee rather than here. Councillor Gill.
Thank you, Chair. Yes, the Partnerships Committee at its last meeting did have a report. Much of the data in that report seemed to be the same as I'd got in correspondence with the CCG over August, September. What troubled me, the data I got was marked private and confidential, but then it's the same data that was given to the Partnerships Committee, which is interesting, the way you have to put in FOI requests and get answers back saying marked private and confidential. But the general issue was that face-to-face appointments were around 48%, perhaps 50% in August. The difficulty trying to interpret all this information was that I think the system is called Apex, and that not all the systems are being validated. So the data I saw was based on 23 out of 48 practices, I think. I think in December, based on the conversations we've had, Chair, by email and with officers, is that Health and Wellbeing Board really wants to see how the health service is recovering and progressing out of the crisis and how it's managing. So yes, there are things that seem to fall in strange places because of our structures, but I hope that all members will always take private opportunities to pursue things and find out how things are going, because that's what we're here for. Thank you.
Yes, thank you, Councillor Gilchrist. Yes, and it is planned for the December, as we discussed earlier on today, Health and Wellbeing Board. And comments for Councillor Gilchrist, responses? Oh, okay. Right. Did you need a response for Councillor Camphor? You have another question?
Thank you, Chair. Perhaps a clarification before that, before you all shoot me down. I am a GP, and I hope I'm not conflicted in saying this, but the Apex data that Councillor Gilchrist mentions is something that was done as a GP forward view thing 4 years ago, and it was given to practices to use to implement their workforce and workload problems. It wasn't to monitor their GP appointments. GP appointments are actually monitored across the country, nationally, in the four nations. And finally, I know that GP appointments is a very topical issue and very relevant, and I understand that, but there are some practices in the Wirral that are now completely open, offering face-to-face appointments. Thank you.
Thank you, Councillor Camphor. So those comments are helpful, but can I just remind you that you're here as a councillor, not as a GP? Thank you. Right, any further questions? Chase, Councillor Walsh.
Thank you, Chair. I've got some points to Moira asking for more data. I was just wondering if it's possible to get some of this data as well. I think you've touched on average wait time for an ambulance. It'd be interesting to know the average number of outstanding calls on the Wirral as well. Perhaps it's only available for MWAS. And the average wait time for people who are to be discharged, which we might already have, but for care packages from hospital. And then also I just wanted to ask a question on the transfer to assess information. It might be in this report and I just can't see it. Do we have a current level of capacity, or what capacity we're at on those beds?
Thank you. Having some technical problems today. Perhaps I could just respond to Councillor Gilchrist's comment about or question rather, about the GP appointments first, and I'll come back. My computer shut down at that point, so I was a bit distracted. The CCG are currently collecting and validating all of that data. So they are almost in a position where they've got a complete picture for all the GP practices and the percentage take-up of available appointment slots and the percentage that are face-to-face. So I know the BI team have been focusing on validating that work this week, and I'm sure that will be made available. Okay, thank you. On the question about ambulance waiting times and turnaround times and times for packages of care being waited for in hospital, all of that data is available. It's just not reported in this way. I think the last time we reviewed the performance pack for adult social care and health, it was very much led by members as to the content of the pack and the report, and it does sound like it may be that members would wish to review the content of the report again to see if there are additional aspects of NHS data that you'd want including in it. But certainly that is available, and I'm sure I can provide information via my colleagues in the NHS to members on those areas for now. Members may want to consider whether they wish to review the pack going forwards.
Sorry, there's also the question around the occupancy of the transfer to assessed beds. And just to your point, the reason I think we're all kind of asking various points around care is just I'm sure we all believe that everybody should have access to the care that they need at that moment in time, whether it's an ambulance or whether it's a GP appointment over the phone, whatever it may be. And we're just maybe trying to use some of this data to ascertain where the pinch points might be that are causing the problems. Thank you.
Thank you. If I could just respond on the discharge to assessed beds. So we're still in the transition phase from the previous independent care home beds, which are phasing down. So their contracts have ended and they're phasing down. And the new provision on the single site offer at Clatterbridge is up and running with the 2 wards. The 3rd ward is being planned and hopefully that will be opening next week. The plan is for it to open next week once the full staffing cohort is in place. And again, that will open in the same way that the previous 2 wards opened on a phased basis. It's usually in blocks of 6 beds at a time. So it would first open with 6 beds and then build up to 12 and so on. So we're hoping that would happen next week. As of today, the current occupancy of the available beds at the Clatterbridge site was 86%, and there were 3 patients lined up for discharge. So obviously as patients move out, the integrated discharge team are identifying patients that are ready to go, fit for discharge and needing to benefit from a therapy-based, bed-based service. So they are identified for those wards. So it is generally proving to be a well-occupied service with a good effective turnaround on a lower length of stay at around 3 weeks. This week it was showing a length of stay of 20 days, which is significantly less, and the majority of people getting home with the support that they need. So that's data as of today from my my memory from the discussion earlier. We can certainly include more granular detail on this in future reports if that's requested. But I would just like to assure members that there's a snapshot of some key data presented in this report, but that's not the end of it, because day to day we go over all of the data. There's a very detailed transition plan for the D2A beds, showing week by week the numbers of beds available in the system and the occupancy. So we are quite data rich, and it's how we want to report that and present that, but we're very happy to discuss that.
I think the Director's got something to add, and then...
Thank you, Chair. I think it's on the it's really on the general subject area of performance across the NHS and care, because I completely agree with committee members that the whole picture is important. Just seeing one part of the picture is not particularly helpful. The system currently is characterised by a huge amount of pressure, and what we are seeing is pressure in the hospital in terms of the total bed numbers, with the hospital pretty much full at any one time. The good news is that the numbers of people who are specifically in the hospital due to COVID or have COVID whilst they're in hospital has reduced. So some pressure is reduced slightly there. But in terms of the length of time people are in hospital before they get the support that they need to go home, those lengths of time have increased. So that's adding a pressure. There are a number of reasons for that, but one of the reasons is that actually domiciliary care is struggling in terms of being able to get enough carers to provide the support to people in the community. And I know that whilst that's a problem in the hospital, it's an even bigger problem in our community at the moment, because there's people who are waiting for them. At the same time, we have significant pressures across the North West Ambulance Service, where ambulances are having to wait for very long periods in hospital and have had to take action in order to be able to get out and see to the people that immediately need their support in an emergency situation. So there has been action there. I think what's hard to do is to present a full picture like that in a performance report, which would be published 2 weeks before the committee meeting, and to provide you with a contemporary picture of what's going on. Now, I guess what we could do, in a similar way to the Director of Public Health does the COVID-19 pandemic report, we could provide a regular contemporary report here at committee in relation to the state of health and care in that more operational sense, which can then be verbally updated at the committee meeting. So that might be helpful to elected members to give that kind of picture, clearly supported by data, but to give you, I think, what you need, which is what's going on at the moment and where are the key pressures and what are you doing about it, I think are the questions that are being asked tonight. Thank you.
Yes, I can see the value of that. Clearly not for the entire content of the performance report. I don't think we want a verbal update on all of those pages, but I think there are some key questions that members do have some key concerns, like occupancy levels, length of time people are waiting, how many people are waiting for discharge from hospital, waiting for domiciliary care packages, what's the occupancy levels in care homes, what are the pressures on the hospital, and so on. So I think those kinds of key areas can be brought in a verbal update, and perhaps we can discuss those with the next chair and spokes time we get together on the budget monitoring panel. Is probably the time you get us all in the one place, or the agenda briefing, and we can maybe discuss exactly what areas we would like, but I can think there's a lot of value in that suggestion. I can see nodding around the table to that proposal. So are people happy that we ask officers to do that? Yeah, good, okay. Right. Councillor Mountney, no, not at all, that's what we're here for.
Chair, thank you. Earlier on in the presentation, a third of our care homes, or more than a third perhaps, are unacceptable. Now, if my parents were in one of those care homes, I'd be on to you or whoever I could get on the telephone to have it fixed today, never mind in a month or 2 months or 3 months. Can you give me some timeline as to when that number will come down from a third, and to what level you accept as acceptable, because there's always going to be some that are unacceptable as they face issues. Can you give me those assurances, please?
Briefly, probably no, because I don't know, I can't say how long it will take individual care homes. They all have their individual improvement plan where they are rated as requires improvement or inadequate, and that improvement plan is dated with a target completion date, and it is reviewed, but they're not all the same because it depends on the different areas of inadequacy and improvements that are required. Some of them are quite lengthy with lots of quite major things to do. Some of them are 2 or 3 areas that require attention and can be done relatively quickly. Sometimes it's through staffing changes, for example. So it's very difficult to give a kind of time frame for when improvements would be made. We are constantly working on it, and our quality improvement team are in weekly and often daily contact with those homes that have improvement plans. They do tend to, the approach we tend to take where care homes are re-inspected and they perhaps dip down into requires improvement, we often agree a voluntary suspension on new placements, and we do check that residents that are living in that care home are safe and well and being looked after appropriately and adequately, albeit that there are improvements to be made. In the very rare occasions where we have significant concerns for safety, we work hand in glove with the CQC, and we do make alternative arrangements for people if they're not being cared for safely, but that is very, very rare. it's difficult, isn't it, to identify what's an acceptable level, because we would want all of our care homes to be either outstanding or good, and we know that we're never going to achieve that probably. We do have over 120 care homes in Wirral. We've talked previously about that being quite a difference compared to other local authority areas, and in some sense we've had some oversupply of care homes, and that is reflected in the vacancy rates. Sometimes if care homes continue not to improve and not to invest in their improvements, and they don't raise their standards and they continue to be inadequate or requires improvement, often those do come to a conclusion, and we have had care homes who have chosen to exit the market and to close. We've had that in the last 12 months, and that's through a safely managed process. So I can't really give a figure on how long it takes a care home on average to improve, or on what's an acceptable level, but we all accept that the standard currently is not adequate and we want it to improve.
Chair, thank you. I just come back. You outlined two issues there. One where they may have one or two issues that are relatively quickly to solve, and I'd encourage us clearly to get those fixed quickly and get them operating at an acceptable level. The other end of the scale was where they've got numerous issues. And my question would be, well, how the hell did they get to that without us picking it up before they got to that level of issue?
Yeah, it's fair to say that the Care Quality Commission has changed its inspection regime over the years, and of course that's been impacted by COVID as well, where there was quite a period of time where face-to-face on-site inspections weren't carried out. They have been resumed now. So where care homes are rated good or outstanding, there is quite a period of time before they're re-inspected if no significant concerns have been raised, and sometimes they dip down. We do have under normal circumstances, out of COVID restrictions, we do normally have a range of professionals going in and out of care homes, nurses, social workers and clinicians who do identify and report back where there are concerns, and our quality improvement team do address them. Where I've referenced improvement plans where there may be a number of areas, they can vary considerably. Some of them will possibly be environmental things that need changing, flooring, alarm systems updating, or some of its training records, some of its numbers of staff ratios. It can be quite far-ranging, and not necessarily concentrated all in an area that would immediately directly impact on direct care. So it is a mixed picture, and each improvement plan is different to address the particular issues that it needs to improve on.
Thank you.
Thank you. The conversation I was just having with our head of legal services wasn't because I wasn't interested in what Jason was saying, because I was asking the question, when we suspend placements in residential homes or nursing homes because they are requires improvement or inadequate and we have concerns about them, and so we as a local authority suspend placing people that we pay for. The question I'd asked was, can we publish those names? Because I've always had a view that if we're not prepared to pay to put people in, then really do the public not have a right to know that? There are issues around it, so I've suggested that the Director of Legal Services bring a report so that we can discuss the issues here and make a decision as a committee about how we feel about I think we are all aware of that, Councillor Camphor, thank you. And that is a public information. It's not about that. It's about saying that as a council, we are not prepared to place people in those care homes, and it's whether or not we take a view that in that case, should the public not know that we don't consider that we would be prepared to place people there. And because I know, just thinking that if I had placed my mum or dad in a care home and then later discovered that the council weren't prepared to use it, I might have very serious questions about that. So all I've asked is that the Director of Legal Services bring us a report, because there may well be some legal issues around that. And I'm sure there are, which is why I've asked the question. It's a question I've been asking lots of people over many years, and legal people always got a funny colour when I ask that question. So I think we should, as a committee, look at the issues and see what we can do. Councillor Gilchrist.
I think, as Councillor Moira McLaughlin is sitting next to me, probably over 3 or 4 years, we sat together in the town hall meeting members of the team that do the inspections, and the issues about dipping in and out of things in terms of management or training, all the things that worry us kept coming up over those years. Position where we can drive up standards. We did a lot to support the sector through COVID. We championed the concerns about all the protective gear. We helped them in many homes throughout. We also did work for our officers to track down training, and in staff movements we put money in order to help support the our homes with COVID, so that staff didn't move around the homes as much. And of course we wanted the real living wage, so we had step-by-step approaches to trying to push up standards. And I think now we're at the point where we say, look, this is it, we're almost there, but some of you are letting us down, and be pointed about it.
Thank you. I've got Councillor McLaughlin and Councillor Camphor.
Thank you. It is a follow-on from Councillor Gilchrist, and yes, and we have looked at this many times and in depth over quite long periods of time, and this issue of homes dipping down, just about doing enough to stay in business, if you like, but never putting in the investment to lift themselves out of that position where they're just hovering on that line. And it is often the big providers who will do that, and it does appear to an outside person that it is a policy decision to keep functioning at that low level, which is very worrying. And yes, there's been an awful lot done here locally to try and lift the status of the staff who are working in there, improve the rates of pay there, in the hope of that will lead to improved standards, and so far I don't think we can say that has had a significant impact. And there are lots of other factors at play here, and it would be good to know, as you say, that we could, I don't want to say name and shame, but we could take the lead for people who are looking to find good homes for their relatives, by saying, actually, we don't want to place anybody there. You have a look whether you think that's good enough for your relative. So I agree with what you're saying, and I also agree that we've done an awful lot, but it doesn't to encourage improvement. But if you've got big, and I have to say some of them are based offshore, aren't they? They're big businesses who are running this and who are doing it as a matter of policy. It does change.
Which was that CQC report is contemporaneous and is updated automatically. Should the council decide to do a so-called sort of rating of nursing homes, how contemporaneous will it be? Will it be sort of updated on a monthly, weekly basis? And what assurance will we have that that is benchmarked to something which is nationally done by a statutory body like the CQC?
For discussion tonight, and I don't think we were suggesting a rating, we were suggesting information which would go out to the public, but there was going to be a report about it, and I don't think there's a lot of value in discussing it tonight unless the committee particularly wish to. I think discussing it without a report in front of us, and without the facts in front of us, is probably not that productive. So, if we have any further questions on their performance report, I'm going to move the recommendation. Do I have a seconder? We note the content of the report. Councillor Cottier, thank you. Brings us to item 10, the integrated care system update. Thank you, Graham.
Can we just make it clear that dispensation has been granted? Would you like me to say that?
Can, yeah, if you want to.
Chair, members, I just wanted to remind you and to make it clear to people watching that on the 30th of September the Constitution and Standards Committee granted a general dispensation relating to interests to all members for the rest of the municipal year in respect of matters relating to the ICS. For the purposes of openness and transparency, it is of course still right and proper that members should declare their interests at the committee, and then obviously for assurance to be given that a dispensation has been granted. Of the British Medical Association, so I'm sure he will be happy for me to just remind the committee of those declarations he's made in the past. But again, as I say, I just wanted to confirm that it is appropriate in light of the dispensation for members to take part. But Councillor Camphor.
Thank you, Vicky. Yes, so I am a GP at Heatherland Medical Centre in Woodchurch. I'm also a member of the BMA, but also the chair of the Community Care Committee of the BMA. And I'm also a medical secretary for Mid-Mersey Local Medical Committee, which is a statutory representative body for general practice, representing St Helens, Warrington, Halton and Knowsley. And I also represent GPs across Cheshire and Mid-Mersey at the BMA. I'm also executive trustee of Age UK Mid-Mersey. So they're all outside of the Wirral. And my wife works as a nurse practitioner, diabetic nurse practitioner in Ellesmere Port. Thank you.
Chair, I'm sorry, I neglected to declare an interest earlier as well, relative to the works for the NHS, and I'm in receipt of an NHS pension. I don't think that's...
Thank you, Chair. So this report on the integrated care system and integrated care partnership development is largely for information. It's an update report, and it comes after our meeting with councillors on the 14th of September, where we went through the current position around ICS and ICP in some detail there. Of course, what was presented then and is still the case is that the bill is still at committee stage. So as that comes out, we'll know more about how things are evolving. So included within this report is reference to a preferred option of the local authority operating with a joint committee with the ICB, which is part of the arrangements around integrated care systems. At minimum, that joint committee would need to be local authority and ICB. In essence, that would enable decisions to be made around pooled funds, etc. Clearly, the joint committee could be much larger, and there would, in terms of a place board, a place partnership board, then it could involve an awful lot of other members. And there's a lot of work to do still in terms of defining membership and coming back with some further developed proposals. Officers from the local authority, small group, and a small group of senior officers from the NHS did meet with the members of the integrated care system on Friday past, really to further discuss those arrangements. But in essence, what was discussed was very much what's in this paper, the notion of a joint committee, the importance of the Wirral plan as the core plan for the borough for all aspects, not just health and care, but all aspects of the borough and improving outcomes for our people. And I suppose, the potential structures around how we could work together, and of course, the role of the Health and Wellbeing Board as having oversight of the health and wellbeing strategy and a joint strategic needs assessment. So just to say, really, there's a lot more work to be done, and as we learn more about how the bill progresses and information comes out of the current ICS chair or chief executive, then clearly that will be shared and continue to be shared through committee. Thank you.
Any questions? Anyone? Councillor Gilchrist.
I think, because the matter might well be debated at council, that Graham has the job of producing a holding report. I'm not sure whether Graham's holding the baby or holding a hot potato. What I had noticed is that the Cheshire and Merseyside Health and Care Partnership issued a statement today saying they haven't yet been able to elect a permanent chair, that there is an interim chair who will take things up till the 31st of March 2022. And some of the people I've come across over the years in the health service, you would have great faith in because of the work they've been doing in other organisations. What troubles me is I don't know who's going to be at the top of this, what the steer eventually will be from the government. Everything at place, we all love the place. Place is a wonderful idea. It's what's happening beyond the place that troubles members.
I think just to say yes, I think the temporary arrangements have been published today, and welcome to have some continuity there. Thank you.
Any other comments? Councillor Camphor.
Thank you, Chair. So just a point of clarification again. So David Flory will continue till the 31st of March. There were some interviews that were held this week, and there were lots of people that went for the interview. Unfortunately, none of them got elected or selected as it is. My second point I really just wanted to make clear was place is paramount and key in the delivery of integrated care systems, and it's really important to have the partnership committees with the CCGs and others, other voluntary sectors, implemented in place, because we've only got 5 months or 6 months to go. Whilst we await directions and clarity around the integrated board, the NHS body, from the bill, I think it's really important to establish the links and the partnership committees with the local CCGs. We have a great example in Cheshire and Merseyside in that St Helens have an integrated system and have had one for the last two and a half years, where the local council has worked very closely with the CCG. And it might be advantageous for this council to perhaps speak to St Helens and find out what they've done in the form of integration. Thank you.
Yes. We work very closely with all of our colleagues in the Liverpool City region, including St Helens. I meet with all of the chairs of the Health and Wellbeing boards and the portfolio holders on a monthly basis. And I'm well aware that the officers meet just as frequently. We do, and we are already, I think as the directors explained, working to put together our partnership committees. We do recognise the importance. There won't be a CCG, so they won't be a part of those committees. But we are working on the governance and what the governance and the structures are going to look like, so that we are fit and ready to function as a place come 1st of April next year. So thank you for that. Councillor Cannon.
Thank you. It was just in relation to a discussion we'd had earlier on the Better Care Fund, and I was just looking at the setting budgets for place. I mean, is this a positive position that you think we're going into with this, Graham, with having that extra money from the CCG, and is that something that we can be assured about keeping it as local as we possibly can? Thank you.
Thank you, Councillor Cannon. So the indications at this point in time are that agreements that are in place during this current financial year will be carried forward into next financial year, and that's described as a steady state position. So it is hoped that by having a significant pooled fund arrangement, that will enable us to continue to have the leadership at place in terms of how those services are deployed, what their priorities are, and how they respond to the needs of our local population, as opposed to that being delivered at a Cheshire and Mersey level. The key difference is that what we've got in our pool funds are primarily community services. You will note that there's hospital services, for example, aren't in there, and specialist services aren't in there, and it is highly likely that those services will be commissioned at a Cheshire and Merseyside level directly through providers. But yes, having that higher level of a pool at this stage gives us a much better chance of having that local place direction.
Any other questions, comments, anywhere? No? Right, in that case then, thank you very much for that, Graham. And can we have a proposer and a seconder for the recommendations? Councillor Frost, thank you. Have a seconder? Recommendations? Councillor Mountney, thank you very much. Moves us on to the, I don't see anybody objecting, so that moves us on then to the Wirral plan, delivery plans. Graham.
Thank you, Chair. This report presents the draft version of delivery plans that are emerging set against the Wirral plan. The Wirral plan, of course, was signed off at Council on the 6th of September, and the idea of this report, which is going to all committees, is that those committees have sight of some of the key deliverables that are being set against that Wirral plan. So specific actions are identified against the 5 key Wirral plan themes, and those draft delivery plans are set out in Appendix 1, and the idea there is that committees will have further consideration of those. the plans do reflect current priorities, as far as I can see, certainly in relation to this committee's agenda, and don't duplicate actions. They are actions that are in train or expected to be in train. Updates on delivery of those priorities are expected to come back through to committees. I think I should just point out that there are a couple of items that are within the remit of this committee, but that are sat in themes that don't necessarily sit directly, obviously, within this committee. One, within the safer theme, the domestic abuse strategy, responsibility of this committee, and under Brighter Futures, there's a significant overlap between the Children's Committee and the Adult Committee in relation to SEND, but particularly in relation to transition of young people from children's services into adults. There may well be others as well. They're the key ones that have jumped out. Thank you, Chair.
Councillor McLaughlin.
Thanks, Chair. Yes, I was looking at it and thinking that it does present a problem, really, when things are compartmentalised in this way. And I'm looking at the housing, which doesn't come under ours, but of course is a very important part of what we would be looking at. It doesn't say anything there about specialised housing, extra care housing, which we have talked about, and we talked about last week at the spokespersons meeting, didn't we? So, it's good to see things written down, the plan, the formula for delivering things, but it does also present problems when things are compartmentalised in this way.
Thank you. Do you want to respond to that?
Thank you, Councillor. Yes, I think that's a very important point. And of course, one of the opportunities we have here is to comment on those things that we would expect to see in the plan that we can't clearly see. And I think the extra care housing, whilst there are a number of strategies within the Active and Healthy Lives, which talks about smart homes and extra care housing, it isn't reflected in the housing strategy. So I think we should perhaps work out, well, how can we make sure that the Housing Committee has sight of specialist housing, for example, within that, and sees a clear overlap with the work of this committee.
If I may come back on that, we did talk at length a week or so ago about the need to absolutely embed housing and planning in what we're doing in terms of provision for the more vulnerable people who need specialised housing. And yet here it's put into another little box, which, you know, which isn't necessarily going to get the specialised attention it should.
Yeah, just if it's helpful, on that, Councillor McLaughlin, I have last week before, met with the Chair of Housing, the Chair of ERD, and the Vice Chair of Planning to precisely make the points about extra care housing and the importance of it, in the overarching strategy, not just for this committee, but for many others. So. Any other comments, questions? Councillor Camphor.
Thank you, Chair. So I just wanted to take this point up with the Wirral Theme Delivery Plan 2021, Safe and Pleasant Communities. And I welcome this number 1, which is Domestic Abuse Strategy, Adult Committee, and talks about engaging with underrepresented groups such as elderly, LGBTQI, pregnant women, people with learning disabilities and difficulties, and people living in more affluent areas to understand how they are affected by domestic abuse. It doesn't give a time scale, and so what I would like to know is there a time scale attached to it, and how are we going to engage? Is there a process that is mapped out?
Thank you, Councillor. The detail is in the domestic abuse strategy, and should committee wish to unpack any of these in detail, including this particular strategy, then be very happy to have appropriate officers bring the reports here so that we can really get into the detail of how it's being delivered.
Could you give us
Councillor Frost.
Thank you, Chair. It's on the same topic, and I know it's one that we've talked an awful lot, so I think the Safer Wirral scheme is helpful that we're talking about it in this way. We talk a lot on this committee about domestic violence and domestic abuse in the context of wider gender-based crimes. It's really front of mind for me, I think, that with the government's significant lack of willingness to term misogyny as a hate crime in order to better tackle violence against women and girls, these domestic violence, domestic abuse, as we know, we've talked about before, happens within a pyramid, and it's lower level crimes like street harassment that support these higher level crimes, which ultimately, unfortunately, are topped by murder and rape. I know the PCC is working for Merseyside to try and work out how we can push forward with coding misogyny as a hate crime in order to better tackle it, and I think they're waiting for the Law Commission to publish the advice locally of what we do. So I guess it's half a question, half a statement. If we think it's the right thing to do and if the government won't support us on it, but the PCC is it something that we can talk about once the Law Commission's advice is published on this committee to work out how we can use better quality data of misogyny as a hate crime in order to support our broader domestic abuse and domestic violence strategy, as well as our kind of collective gender-based violence and violence against women and girls strategy.
Clearly there are a number of elements within that, and I think that what we would need to do is reflect on the content of the current domestic abuse strategy, see if those elements are covered. I'm not sure exactly how the data is collected at this point in time and whether it would fit the criteria that you've set out, Councillor, but that may well be able to be considered. There may be issues within there that should be referred to the Community Safety Partnership, but I think we just need to, again, just to really understand what those issues are and how they may be unpacked appropriately.
Yeah, certainly on the question of violence against women and girls and the 16 days of action, White Ribbon Day, etc. The Domestic Abuse Alliance are currently planning a whole series of activities, but clearly whether this comes back to this committee is dependent on the outcome of the decision around that.
Thank you, Chair. And it would, even if it doesn't formally come back to this committee, I think, given how much attention we've paid to it, I think it would be helpful, even if it doesn't come back to this committee as something that we can speak on, headlines coming back to this committee, I think, that we can at least keep in mind when we're discussing the stuff that is within our wheelhouse would be really helpful.
So we find it difficult to see why misogyny would not fit within the domestic abuse strategy, but we'll see.
I agree with you. Thank you, Chair.
Councillor Camphor.
Thank you, Chair. Just reverting back to my initial question, which is around the time scale. So domestic abuse is obviously a very important issue in LGBTQI and other sectors as well. Can we have a time scale for this rather than just words, please?
Thank you, Councillor. I think a report needs to come back, a detailed report.
Any other comments on the implementation plans? No. Right, thank you. Well, we've noted, I assume we have the note, we've noted our comments as a committee, which is what we've been asked to do, which consider and comment, which is what we've done. So can we have a proposer and a seconder? Councillor Frost, Councillor McLaughlin, thank you. COVID, Julie. I sat there patiently.
Thank you, Chair. So this is the regular report that provides the committee with an update on Wirral's COVID-19 response and the delivery of the local outbreak management plan. Just to make some comments about the current epidemiology in the borough. So we are still seeing widespread community transmission of the virus across Wirral. Up until the 7th of October, we had 1,196 cases reported in the 7 days till the 7th of October, which is an average of 162 cases per day. The largest proportion of which were in children and young adults, with nearly 40% of cases being in those aged 10 to 19. So our 7-day rate up until the 7th was at 368 per 100,000. And the local increase matches the national picture, where rates are increasing again, with the England average as of the 7th being at 357 per 100,000. So widespread transmission still going ahead, still going on rather, and we are seeing an upturn in the number of cases. There is some good news, which is related to the overall vaccination uptake, in so much as just over 83% of our eligible population have had one dose of the COVID-19 vaccination, and 78.7% have had 2 doses. We've also got reports that the rollout of the booster vaccination and the 12 to 15-year-old vaccination is going well, with initial feedback from our school nursing service that the uptake for the 12 to 15-year-olds in schools is higher than that that's being reported nationally. But that data is only just starting to come through to us. If I just say a little bit about education, as I've mentioned, the largest proportion of our cases in the 7 days were in children and young people. But I think the key principle I want to just outline is that transmission in educational settings is low. What you're seeing there is the community transmission, but we're very easily able to spot that obviously our children and young people are in school, which is really, really important. And obviously the priority is to keep our children in school as well. But we've got a clear local plan for supporting our schools and to put any additional prevention measures in settings if need be. And any restrictions to access to education would be the absolute last resort. Working really closely with our head teachers who've been phenomenal, I think, throughout all of this, and working very closely with us with regard to obviously keeping schools safe, and, as I say, to really push forward the vaccination programme as well. So I believe our local situations are being managed in a practical and proportional manner as well. You'll also see that within the paper we talk about the fact that on the 14th of September the government published the COVID response and their autumn and winter plan, and we're currently updating our local plans to reflect national policy, and we will be bringing those key points to you as we go forward. I'll probably stop there. I haven't got care home vaccination figures, but we can certainly get those and report those back to the committee. Thank you, Chair.
Yes, thanks for that, Julie. Yeah, I was interested to, particularly in care home staff vaccination figures in the light of the required compulsory vaccinations, just wondering where we were up to with that. So that will be helpful if we can get that information. Any questions for Julie? Councillor Gilchrist.
Well, I know that we've got a programme of money till next September. I think I'm right. I know it's some time ahead, but I begin to think that if COVID outbreaks come back every now and again in a cycle, depending on what degree they are, I began to wonder what happens as we get to next June, July, August, if we need to know to plan ahead. Public health has a budget. It does so many things, from drug, alcohol, and all the other things that Julie's department does, or team do. But I'm wondering what happens in the year or so to come beyond that. Difficult for us to have some sort of crystal ball, because I've no idea. Don't think anyone has an idea. But And perhaps government, based on the recent report, may have conflicting advice and say, well, the scientists said this and the scientists said that, and we don't know. None of us really know how good things might be or whether there might be hiccups on the way. So I cast my mind back to the 80s when there were all sorts of training schemes that people were on when the money ran out. Probably remember some of those, but things grew out of those. But I'm wondering now if there's a point during the year when we've brought together and trained and got teams working in the streets through Connect and all the other knocking on doors, all those things we've got, whether we need at some point to say, well, we have to keep this work going and government should help us to keep that work going, because we can't suddenly next June, July say, oh, the money runs out in October or sometime, I'm sorry, this is the end of that kind of work. I think we need to start working through what might or might not happen and have an idea of what we should be asking for from national government at an early point so we can plan. I'm sorry to be sort of pessimistic, but I'm also looking ahead to see what might need to be done and how we can move beyond this next 6 months or so.
Thank you, Councillor Gilchrist. It's a very lively conversation that we're having at the moment. There's a few things there. Obviously, Public Health England ceased to be as of the 1st of October, so there's a new body now. Well, there's a few new bodies actually, but the UK HSA, UK Health Security Agency, has been established. Also an Office for Health Improvement and Health Disparities as well. And then there's also elements within NHS England that have also got some responsibilities that used to be with Public Health England. So we're just trying to understand how that's all going to operate. We are lobbying as Directors of Public Health very strongly that the funding we've received through the Outbreak Management Fund is definitely able to be carried over into the new financial year so that we've got some security, as you say, around a local response through until the spring, summertime. I do have some anxiety at the moment about whether that funding, we will be allowed to carry that funding over or not. We're then told that actually through the comprehensive spending review, that's where we'll be told about any funding in the future with regard to the local response. So I suppose I'm saying that your comments are absolutely all the things that we're thinking about at the moment. We want to have a local response that goes forward. We think we've shown how having a local response with regard to communicable diseases has worked well. We are having very lively, as I say, conversations at the moment with the UK HSA and the Joint Biosecurity Centre as well. Sorry, there's all these phrases. So it's definitely live and kicking. We have got a working group of members coming up in the next couple of weeks, which again, we can talk about this then, and we've got to wait for the outcome of the spending review as well. So there's quite a few unknowns, but we are definitely planning to have a local response. We just need to have the funding confirmed. Thank you.
Councillor Walsh.
Thank you, Chair. I just wanted to ask, in terms of the council-owned buildings like the Woodchurch and Oval Leisure Centre, how long are they going to be continued to be used for the vaccine rollout?
I'm sorry, I don't know. I'll find out and let you know.
Thank you.
Councillor Camphor.
Thank you, Chair. So I have three questions, really. First of all, is the third booster and its uptake across Wirral. Secondly, the COVID vaccination in children under 15, and the anecdotal evidence that COVID positive tests in under 5s are rising. Your comments, please.
Sorry, what was your second question, please?
Under 15s, the COVID vaccinations.
Sorry, you wanted the data?
Yes.
That's NHS data, which we're just trying to ascertain from them. So as soon as we've got them, then we'll be able to share that with with the councillors, because you'll be aware that we do publish weekly the latest data that we have, and that will be included on that. So that's both the booster uptake and the 12 to 15-year-olds. I haven't heard about the... so again, just going back to the under 5s, we aren't particularly seeing that our under 5s are an outlier in any way, shape or form, but obviously that's something we will keep under review.
Councillor Cannon.
Thank you, Julie. It was just a question about the community champions, really, and just how amazing it is to have 700 local people involved. It says that we're doing an evaluation programme and you're expecting that survey back soon. Will you just bring that back as a verbal report? I mean, obviously we don't need all the details, but I really do hope that's something that we're going to continue with, because it's had a huge effect, and I'm sure, I mean, obviously I don't want to predict the outcome of the survey, but I'm sure in our harder to reach areas, that must have been absolutely the phenomenal impact of that in those areas. I'm sure we should be able to see in this committee. Thank you.
Sorry, yes, of course. Yeah.
Any other comments or questions for Julie? Right. Okay, thank you very much.
Yes, happy to move.
Sorry, Councillor Berry. I was demob happy there. And that's the last item, which isn't really item 12. It's actually item 13. It's got item 12 twice on my agenda here, which is the work programme. Over to you, Vicky.
Thank you, Chair. The purpose of this report is to ensure that members have the opportunity to contribute to the delivery of the committee's annual work programme. Clearly, Chair, you're already a very busy committee with a significant number of items on your work plan. And I think several more items have already probably been suggested during the course of this evening, but this is an opportunity for any further comments that members may have in relation to the work programme.
Councillor Cottier.
Yeah, thanks, Chair. In light of comments been made previously, I noticed that on the additional agenda items waiting to be scheduled, there's the domestic abuse strategy update. I think I know it's obviously we are packed to understand that, but I think in light of the comments been made, I think that I'd like that to be scheduled, if that's possible, please.
We can do that. Any other comments? Right, in which case, and I thank you all. Oh, thank you all for your, I need somebody to, yes, I need a mover and a seconder for the work plan, even though it's the same work plan. Right. Councillor Cannon and Councillor Cottier, thank you. That just leaves me to thank you all for your attendance and thank the officers for their time and for their reports.